pharmacists can serve in multiple different ways to help patients be adherent to regimens. The first way is to counsel, to speak to the patient when they're picking up, especially on a first fill, or if they're seeking out information from you on what are some of the side effects of these agents, so that you can review that in the beginning, put the patient at ease that some of these side effects may actually happen, and that they're known to happen, like gastrointestinal upset with liraglutide, but that they should still be able to continue with the agent. And then when patients, if they do see some side effects, when they should be able to talk to their physician. So I feel like if patients know this first, they know what to expect, they're educated on their agent, and then they're more likely to stick with that agent, as opposed to reading the information that they're getting in their home, or looking it up on the internet and maybe getting false information, or information that may be perceived as being scary or detrimental to their health, where you can have that discussion openly and in the beginning on the level of dispensing. The other way pharmacists can help motivate patients in terms of their compliance is if you're noticing refills, especially for these agents that are being marketed in terms of weight loss management. And you could say, you know, how's it going? How are you seeing response? Or you can say, wow, you're looking good. How are you feeling on this agent? You know, slightly be the cheerleader for your patient when they're coming up for their fills. If there's any questions that they have, that you're available for them to be able to speak to with it. The other note for this is that most of these agents, if by 12 weeks, if patients haven't had that 5% weight loss, they actually should discontinue the product, and that's actually in the FDA evidence. And either they could trial a different product, or they need to reevaluate the strategies that they're using in addition to the medication, and if they're not doing diet and exercise modification, then they should be. So that 12-week point, so basically three fills, you know, is a great time to talk to the patient to see how they're doing with their medication, if they're seeing that they're having weight loss, and if they, at that third fill, between that third and fourth fill, if they're not seeing any weight loss, then that's a really great point for the pharmacist to kind of step in and say, you know what, I think we need to discuss this, or you need to bring this back to your physician and discuss this, because now should be the time where you're seeing that weight loss happen. So that's a great way for pharmacists to be able to help motivate patients to be compliant, and also help them to be safe with taking their medication.